You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening. You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, good morning to everybody. Joe Gavalis back with the Safe Senior Hour. I hope all is well. Remember, we start out our show every time with the advice: elder abuse does not report itself, and that's very important as we talk about abuse situations. Again, the Safe Senior Hour stands for seniors, abuse, and financially exploited, and issues dealing with seniors. And again, we look at abuse in three areas: one being physical abuse, the other being financial abuse, and the third being institutional abuse. Financial abuse is by far the biggest abuse that happens to our seniors. Again, we're such a growing population, it's really significant. Again, if you have any comments or requests that you'd like us to talk about, please email us at safe@americaswebradio.com, and we'll get to them. And again, we've been very fortunate. We have been asked to speak at various locations, both in Georgia and outside of the state and other states. And I know we'll be going to Tennessee, and we're going to South Carolina, and we'll be addressing some of these issues. So if you have any requests or suggestions of how we can help educate seniors and their loved ones on the abuses that are taking place, how to report them, and who they can talk to, please feel free to email us, and we'd love to come listen to your comments. And if things can work out, come and actually do a presentation in your area. Today, for the first part of our show today, we're going to be talking, get an update on fraud and abuse situations to keep you all aware of new scams that might be going on. And then in our second, third, and fourth, we're going to have a guest, Doug Lueder, who representing Aging in Place Council, that will be on, and we'll be talking about some new developments and suggestions and ideas that you all can think how to help protect and care for your loved ones. As we want to update now on the new frauds, thanks to the Baker Fraud Report, and I keep pushing that because it's a wonderful report. You can look at that, just Google Baker Fraud Report. The latest one, they have a comment about a new fraud that's taking place that is very significant. It's called the One Ring phone scam. Excuse me. The Consumer Federation of America warns that one ring phone calls where they hope you'll call back and then your phone will be charged for calling an international number, and even though a caller ID may show a local number. It's an interesting scam. They estimate over 100 million one-ring phone scam attempts have taken place so far this year. And I've had them where all of a sudden the phone will ring and then all of a sudden go away, and you look at it and there'll be some number. And again, their idea is to get you to call back that number and keep you on the phone because it is just be billing at such a high rate. And if anybody calls overseas and doesn't have a calling plan, you know the cost of calling overseas calls. And then that is paid directly to them because they will go to you will be billed at that rate, and they will already been paid. It's a very intriguing scam. So here's some suggestions here that that are made to help prevent you from being caught up in this scam. Number one, don't answer return phone calls from numbers you don't recognize. I know we say that on the show all the time, but if you don't know the number, listen to the message, and then you can call them back if you know the person or you think it's a serious call. And if you don't recognize it, as I said, let the call go to your voicemail. They will always leave a message. 2, don't trust caller ID. Now, it's hard to say because we relied on that for a long time. But scammers know how to spoof, and that's what the term is called, spoof, S-P-O-O-F, your call ID, so it appears they're calling from your neighborhood. Many scammers strategically locate their operations in country like the Bahamas that have an international calling code like, quote, as an example, 242, which may appear to be American. So just don't trust that. If you think you want to call, you independently research the number that is calling if you have questions about it. Block outgoing international phone calls. If you do not regularly make international phone calls, consider asking your telephone company to block outgoing international calls on your line. You can always get it unblocked if you have to, if your calling pattern changed. And as they do, and I have to say, I'm not really, I don't do this, and I should, but everybody out there should closely monitor your phone bill for surprise charges. If you spot a suspicious charge, contact your phone company immediately to dispute it. This will not only potentially save you money, but also will help your provider spot fraud and protect customers in the future. And if you've been a victim of the phone call, there's a please report it to your local authorities. When I say victim, not that somebody attempted necessarily, but you've actually looked at your phone bill and you've been charged. And some of these charges are like $200-$300. We're not talking like 45 cents or $5. It's a significant amount. So that is one of the latest scams that's going on. We have another scam that is it's called the grant scam, where people will call you and say that you're eligible for some federal grant. They will attempt to get information from you because they'll say all you got to do is fill out these forms and the government will send you and give you money free. Well, there's no such free, nothing's free in this world. Remember that. So be very careful of somebody who calls you and they call that the grant scam. The other scam that's really taking on, and it's got 2 twists to it, is the scam where people call and say that you are eligible under your Medicare or Medicaid coverage to have your genealogy done, to find out what is happening to you. And here's two forms of the scam. One, in one city here in the Southeast, they actually are knocking on doors. People are dressed in hospital garb, those suits, come to your door and say you've been selected, and it's usually in housing areas where seniors live, and ask you, are you on Medicare or Medicaid? And the people will say yes. And they'll say, well, this will be covered, and they'll give you a swab, and you swab the inside of your cheeks, and they put it in a plastic bag. And then they ask you for all your information concerning Medicare and your identification, so they can't be scammed. So you just give it over to somebody who just knocked on your door without you inviting them, all your basic information. And this is sad because, and when I say it happened once, I was at a law enforcement meeting, and I think they just made 18 arrests on this, and they're getting calls every day of people coming in. They don't go and send your swabs in for your DNA testing. They just want your information so they can sell it on the black market. A spinoff of that scam that we saw up in more rural areas is a telephone scam where people claim they are calling. They reviewed your Medicare file or Medicaid file, and that you have the ability to have a DNA testing to determine what risk you are for health. All you've got to do is give. They ask you to get more information about yourself, and say this is since you're in the rural area, nobody can come to your house, that we'll have to mail you the swab kit, but that'll cost, in this case, I think it was $800, and you can pay that by the infamous Green Dot cards, iTunes cards, and before they can send the swabs, they'll call you and say, what's the number on the back of the card or cards, and that's how the scam. You'll never get the swab. So be leery, talk to law enforcement, try to be more prudent in what you do. Two cases that are of interest that I saw that you might be of interest to you all around the country and the world. We talk about senior citizens or anybody who lives alone who has an accident or something happens to them where they fall and literally can't get up. There was a case in Arlington, Virginia, where an elderly gentleman, was rescued when an attentive mail carrier, neighbors and by a mail carrier who saw the mail piling up in the mailbox, hadn't seen the gentleman. Well, apparently the gentleman had fallen and caused a major injury to his hip or some part of his body. He couldn't walk, he couldn't get up, and the article says he survived. This happened in his kitchen. He survived for 5 days by drinking Coca-Cola that he could reach, according to what he said. Said the mail carrier is the first one to notice it. So your neighbors and your mail carriers are hats off to the mail carriers. And it's always nice to meet your mail carrier and know them. They're good people and they're very observant. And this certainly helped him, because if it wasn't for the mail carrier questioning it, he contacted law enforcement who did a welfare check. And remember, we talk about all the time, try to set up some system to your neighbors and check. And the police, if it's suspicious that you need a welfare check for some reason, always call your law enforcement, and they will be more than happy, pending on the cases that they're working on, to do a welfare check, because nobody wants anybody sitting in their home, especially for, like this case, 5 days. And again, I think you've heard me tell the story about a husband and wife, and the husband went down to work in the garden, and way down in the back of the lot, the wife was working in the house, and he fell and he broke his hip, and he couldn't yell. He tried yelling, nobody would hear him because they had like an acre, and she dismissed him. She was doing her work, and finally after 2 or 3 hours she wanted to know where her husband was, didn't see him, and went down there, and there he was laying down there on his on the ground, trying to get help. So try to work something out, talk to your neighbors. And the last case is a horrible case that we will talk when Doug Lueder comes on, about a case in a assisted living home that took place here. A lawsuit was just filed, and we'll go over that as we end the first session of the Safe Senior Hour.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back. Joe Gavalis with the Safe Senior Hour. We're going to be talking during this segment with Doug Lueder, who is the owner of Prosper Home Care, and he's the advocacy chair for both the Georgia Gerontology Society and the American chapter of the National Aging in Place Council. Doug is well known in the industry for being an advocate, and I've had the pleasure of knowing Doug for several years now. And when you find people who are really interested in helping out seniors and taking care of them, and we're just honored to have him.
I'm just curious. You never responded to anyone.
So I think it's it'll be good for him to hear his issue with concerning seniors. Doug, are you on?
I am.
Well, welcome. Thank you. I appreciate it, and I just gave your quick background to our listeners all over the United States and the world, and glad to have you. And we're just about to talk about a matter that I know you and I have had a big interest in, and that is backgrounds for people working in your industry.
Absolutely.
A case that was just filed here in Georgia. And it talks about a worker at a senior care facility used a lit cigarette to burn a woman with dementia on her face and other areas of her bodies, according to the lawsuit. Now remember, all these have to be adjudicated. But the lawsuit also claims the facility initially misled the victim's son about how the woman was injured, and the family later learned the abusive caregiver is a convicted felon who was legally barred from being hired to work in a care home. This is exactly what you and I have talked about on many occasions here. So I know you today, hopefully will go in as your representative of the Atlanta chapter of the National Aging in Place Council. Just give us your idea what you see in the industry about the need for these backgrounds.
Well, gosh, it's so imperative, and I appreciate the intro that you gave me, and appreciate all that you do every day to protect the seniors and the disabled individuals out there that so badly need this care but are so vulnerable. To have people going into homes or in facilities that are taking care of the elderly and the disabled is so important, and to do the background checks and vetting of every sort to make sure these folks are safe to be alone with these vulnerable individuals is imperative. And really it's a loss. So this facility clearly weren't following the rules and regulations that they should have before bringing this person into their facility. That person never should have been allowed to have been hired or to be alone with someone, to do such an egregious thing that they did.
Right.
So,
I'm sorry, go ahead. I didn't mean to interrupt.
I was just going to say, so we spend a lot of time and a lot of money trying to vet all of our caregivers to make sure that they are, as safe as they can be.
Right, and in this particular case, it's even more outrageous. If this is true, what the lawsuit alleges, that this worker, the lawsuit alleges the facility didn't run a background check on this caregiver as required by state law, and this person had prior convictions for aggravated assault, family violence, cruelty to children, terroristic threats, and possession of a knife during the commission of a felony. And that was in 2013 and was convicted in 2016. And also had an arrest charge concerning with drugs. And would shock me, and I'm sure it would be you, Doug, that this was a caregiver at the manor, was not the first sign of trouble, that the facility had fired her after an earlier misconduct case involving resident neglect, but the facility rehired her. And again, this is more the exception than the rule in this industry, don't you think?
Oh, well, thank goodness, yes, because there's obviously lots of providers in all the different segments of elder care that go above and beyond and deliver, safe, quality care to those folks every day. But this was obviously a bad situation, and protocol was not followed.
Yeah.
So unfortunate.
What is the protocol for you? Let's say, I don't know, how many employees do you have that work with you in Prosper Care?
Well, Prosper Home Care currently has about 320 employees, both in the greater Atlanta area and in the Augusta, Georgia area. And we go through a whole list of pre-employment protocols, including not just doing a national criminal background check, but in the state of Georgia, the counties don't all electronically reciprocate their criminal information to the national database, and it doesn't get there as quickly as it should. So it's really imperative to also do county criminal background checks, drug tests, driver's history checks, employment references, etc., to get the best information you can on these individuals before hiring them.
I my hat's off to you and to all and all the people that have companies like yours. Just tell us the listeners what your company does and how common is this around the around the country here.
Sure, gosh, around the country and around the world, as you mentioned earlier.
Right.
As a licensed home care provider, my goal and my mission, more than anything else, is to help the elderly and disabled people age in the place they call home, as long as it's a safe and healthy, affordable option for them. We do this by providing caregivers who are supervised and trained by registered nurses and licensed practitioner nurses to help out with everything from personal care, like daily hygiene, bathing, dressing, toileting, to meal preparation and medication reminders, exercise assistance, companionship, playing games, going for walks, providing that mental and physical stimulation that's needed to keep folks happy and healthy.
Now, are they paid to get your services? Does the government in any way help supplement payment of these costs, or this individual money out of the pocket of the seniors or their loved ones?
It's both. In fact, we are a licensed Medicaid provider. Medicare pays for aid assistance in a limited fashion, usually if it's accompanied with skilled nursing. If someone's getting wound care or occupational therapy or something along those lines, physical therapy, then an aid may also be assigned and reimbursed by Medicare, but it's a very limited amount of time that the aid will be there just to perform a specific task. Whereas for our services, where we come in for extended hours, long-term care insurance policies usually will cover our costs. Medicaid in the state of Georgia has different waiver programs. So there's an application process for individuals that may qualify, but they do indeed reimburse us for care. There are some veterans benefits through the Veterans Administration. I definitely would recommend anybody who may need some extra assistance to check into the Veterans Aid and Attendance Program.
Wow.
Because it does reimburse seniors for things that may not be covered through other means. And then, of course, private pay. So we have a large number of people who luckily have the financial wherewithal that they're not on Medicaid that can pay for services out of pocket.
Let me ask you, and again, I know you're an advocate, but you're also very active in the National Aging in Place. What's your understanding? And I know talking to seniors, listen, we'd rather be at home than be in some institution, whether it be a personal care home, assisted living, or a nursing home. Is there any? Have you heard any like statistics or any? You want to make a comment on that? What you've seen, what you experienced? That home is almost always better than an institution.
Sure. Well, and there's different studies out there, but if you look up whether it's the AAA or through different medical associations, right, it's usually upwards of 90+% of people, when asked where they want to live out their final years, it's at home. Most people do want to stay at home, and studies also show that the outcomes tend to be better. Not only is it more affordable for individuals and for governments or insurance companies to keep people at home in most situations, but the outcomes tend to be better. People, I think people who have the right care at home can do so in many cases more successfully than if they were in a facility.
Well, they're at home, and obviously the older we get, the more dependent we all get dealing with the medical community. Do you interact with the physicians, or how do you interact with them and at home caring for seniors or the disabled?
When we first start care for an individual, whether it's through Medicaid or private pay or long-term care, one of the very first steps is that we send out a registered nurse to do an assessment. And that's so we've had our professionals' eyes and ears with this person, and we document not only all of their diagnoses, but their medications and also the tasks that they need to have a good quality of life there at home. But in the paperwork, we also get permission and ask who their physician contacts are. And when reports come in, we frequently are in contact with their physicians as well as their loved ones to keep everybody in the loop. So we do get permission through signed documents, unless the client has asked us not to, that we do indeed communicate with their medical professionals.
So it's like the total package then, since the concept of home health care, which, by the way, is very, very popular, I know, throughout the United States. It's always been the issue is to get quality home health care. And it sounds like, in your particular case with the backgrounds, and are you licensed and overseen by the state, or?
We are. The home care providers' licenses are assigned by the Georgia Department of Community Health.
Okay.
So that's where anyone that would like to start a home care agency has to go through and has to be approved. And then once approved, they're also there for oversight. So they come in, sometimes announced, but frequently unannounced, to come in and audit us and make sure that our paperwork and our practices are all being followed correctly.
Well, I appreciate that insight, and I'm sure that goes around other states and other countries of the world. They have the same thing. Well, with that, we're going to end our second session of the Safe Senior Hour. When we come back with Doug Lueder, and we're going to be talking about some type of abuses that he has seen in his experience in working in the healthcare industry. With that, we'll move on, wait for our break, and then move on to our third session.
The disease of addiction is a life-altering challenge, not just for the person suffering its effects, but also for the family and friends who support and love the one caught in its grasp. What should be the course of treatment? Who is the best person to render treatment? And what is the best place to go for the care that is needed? We know that you want answers to these and many more questions. Call 770-696-9862 and speak to a representative of the Atlanta Healing Center. They can tailor a program specifically designed to address the needs of the person suffering with an addiction, or give you guidance as to where that help may be found. Information is the key, and the trained staff at AHC is here to assist. If you wish, you can also get more information on the website located at www.atlantahealingcenter.com.
profiles the best businesses, business professionals, business practices, and fascinating individuals to get an insider view of how America works. 10 to 11 a.m. on America's Web Radio.
Your auto love and investment demands the best, and for 45 years, Passport Transport has been meeting those demands. From manufacturers to the one-car collectors and all other facets of the auto industry and antique auto hobby. The first and the finest with unequaled service and peace of mind. Passport Transport, your auto transportation company. Contact PassportTransport.com with your need today. Passport Transport.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Segment 3 of the Safe Senior Hour. Remember, elder abuse does not report itself. You need to report it to professionals in your area. And again, that is physical, financial, and institutional abuse. Today, we're very thankful we have a guest, Doug Lueder, who's the owner of Prosper Home Healthcare and the advocacy chair for both the Georgia Gerontology Society and the Atlanta chapter of National Aging in Place Council. And again, thanks for coming on, Doug, and thanks for your insights on basically the reason to have aging in place. And I was shocked to hear that the surveys show roughly 90% plus people would rather stay at home. And I guess looking at it, I guess I would too. Everybody should do that, but that's when you get in the 90s, that's a high percentile. So I think it's great what you do and your industry does, and the association, the council of trying to promote this. While are you on, Doug?
Sure. Thank you very much.
Yeah. Doug, as we talk about, can you explain more about the council? What it does and what it does, nationwide. I think I know you're nationwide. What do you all do?
Sure. The National Aging in Place Council has a goal of trying to make aging in place a viable option to all seniors and disabled individuals. And we do this through education and advocacy. The better educated folks are, and the more laws and regulations and policies we can have to support individuals, the better our chances are of letting these people age in the place that they call home.
And I looked at your website, and if you could say what is the Aging in Place website? It's let me see. I think I have it right here.
Aginginplace.org.
Right, and it'll show that you have chapters all over the country. And I know in the Atlanta chapter, you can go on and you can see suppliers or people involved with the aging in place at home. Is that correct?
It is correct. So anyone that goes to aginplace.org is going to be able to not only read the mission and the purpose of the National Aging in Place Council, but they can go into the local areas that we have chapters and find vetted providers from all the different walks of senior care, from home accessibility to facilities to home care to elder care attorneys, etc., social workers. Everybody is there and has been well vetted before they would ever be listed, on our site as one of our preferred providers.
I have been fortunate enough to speak at one of the council meetings here in Atlanta, and I was impressed with the variety you have of people who attend. And these are people who not only it's their business, but they're committed to help the elderly or the disabled live a better life. And I was kind of interesting to note, not only are there companies like yours, but there was somebody who was dealing with the mobility issues of like elevators or movable stairs. And, that's really important for some people. Sometimes that's the only difference between staying at home or not is the mobility. I'm sure there are other examples of type of businesses that people can do to help seniors at home.
No, but you make a great point. Making their home accessible is so important to Aging in Place. And I should mention that at the ageinplace.org website, there's a tool. It's called the Act 3 tool, and it's an assessment that anyone who's interested in aging in place or trying to assist a friend or loved one to age in place should fill out this survey, because it makes it more clear the areas that a person may be well prepared to age in place with, but it definitely points out the areas that they may not. And just transportation, for one, that's a huge one. Do you have the ability to get out, to get groceries, to continue to be social with your friends and loved ones? Because isolation and loneliness is a major factor that plagues a lot of the seniors and disabled. It's very unhealthy.
I think that's
so
great.
You want to look at all those walks.
Great, and I think it's great. Could you repeat that website again, where they can go, where listeners can go?
Certainly, ageinplace.org.
That's pretty simple, and look at it. And I remember seeing the survey when I looked at it, and this helps. And I know there are many issues that affect seniors who want to age in place at home. And I know in our area, they call them laboratories. Basically, they're showrooms showing. I know the AAA, and which is the area administrator on aging, has set up a room in our northwest part of our state, and then one of the local counties, and they'll have over 100 items that might be little things, but that will help seniors live a better life and be able to live at home. Are you familiar with what I'm talking about?
I am, and those devices are so important. Everything from devices that help people open jars to making sure they don't slip and fall. I mean, those are some of the ones that seem most obvious, but those devices can really make a difference in one's ability to stay at home.
It does, and again, that 90% plus study really hits home to me. As we spoke to our listeners out there throughout the United States and the world here, that we're going to talk to you here of some elder abuse type matters that you've run into since you've been working in the healthcare industry. Do you got some examples you can think of for us?
Oh gosh, there's the one that really sticks out in my mind most is one of the reasons I'm in this business in the first place. My younger brother Dan was unfortunately in a car accident on 9/11/1987 of all dates, and it left him a C5, C6 quad from the chest down. He wasn't able to move, and although he had lots and lots of wonderful caregivers, there was stories of Dan having things taken from him and not being treated well. So that was really what started the fire burning for me to try to do a better job. And even after getting into business, I had an example of a caregiver that basically with a hidden camera, I determined that they were stealing money from one of my clients. And when I took that video to the police department, I thought for sure there would be a conviction, so it would show up on a background check, so this individual would never be allowed in the home care or healthcare industry again. But lo and behold, this person got out on the first Offenders Act, which I was unaware of. It was kind of like a get-out-of-jail-free card. And so that's what started my passion in advocacy, and with the help of legislators, we got the First Offenders Act amended so that could no longer happen. But that one definitely sticks out in my mind.
Well, I think that you and I have been trying to educate, and again, that's what we do. We're educators more than anything, but the need to have an abuser registry, like they have in dealing with child abuse registries, would really help, because if people go to hire people throughout the country or throughout the world, you want to make sure you're hiring somebody that when you walk away, and you're leaving them, your loved one with them, or you're inviting them into your house, that you're not, inviting somebody that's already had a record of misuse or financial abuse or physical abuse and in the house because nobody's there. And I think I applaud you, Doug, because I know you and I have talked about this. And for the people in the state of Tennessee, I think that registry is just a great example of what can be done. I'd like to get your thoughts on that.
Oh, I agree 100%. And it's not an easy task to set one of these up, and I have faith that Georgia will eventually be able to follow in Tennessee's footsteps and other states that are doing a good job. And one of the things that I find most valuable is that these abusers registries will also hold substantiated cases of abuse, because there's so many of these cases that don't always get in the court of law and get adjudicated, which is unfortunate. True. But these substantiated cases can also help keep some of those bad eggs out of the workforce for us. And I'd also like to comment on what you said about the other abuser registries. It's frustrating that they're so siloed. There's a child abusers registry, there's a sexual abusers registry, and there needs to be a national elder abusers registry, but I'm a big believer in why are they all in separate silos? Abusers are abusers. They're all losers. I want everybody to help say that to their legislators, because there should really be one place that employers could go, because heck, I don't want to hire a pet abuser, more or less a child abuser or a sexual abuser. That's not the individuals that need to be working with these vulnerable individuals that we take care of.
I couldn't agree with you more, and I believe the abuser registry in Tennessee, and I think they've set one up in Kentucky. I think there's one in Delaware. I could go on. I just forgot how many there were, but they're different forms of it. But my understanding, the gold standard is Tennessee. Georgia has initiated through a kind of a pilot program to kind of tie everything in through a fingerprinting situation, kind of like if you're a stockbroker, whatever it is, you got to be fingerprinted. Well, there's laws they're trying to pass like that, and then they be able to follow up and say, well, if you passed it today, doesn't mean like 2 years from now you're not going to commit a crime or that would affect your status and be able to work in a regulated institution. The registry in Tennessee, which I like, and get your comments, Doug, is a citizen who wants to just take care of his mother or his father can just go on there and look and say, I'm going to hire, Charlie, Smith, or something like that from XYZ area, and that'll tell you whether there's anything about Charlie Smith from whatever XYZ Tennessee, and I think that's a good policy, don't you? Oh,
for sure. And I do hope we get there in Georgia. Like I said, and as you mentioned, Georgia's making great strides in getting the fingerprinting database and a more robust abusers registry enacted and in place. But having the ability for anyone to, the regular citizen out there, to have a place to go to make sure that the person that's applying to be a private caregiver, not through an agency that's required to do all the vetting and background checks, to see if they happen to be listed. No, it's super valuable.
Right, and if you can take the time to, as a citizen, you can go on databases and you can try to run it, or by going to a licensed agency, knowing that they have to have the backgrounds done on the individuals again before they're allowed into their homes. And I think that is a big a big burden, and it's removed when you deal with somebody that have passed some kind of a background or license protocol. Well, with that, we're going to take a break, and we'll come back. for our fourth and final segment of the Safe Senior Hour.
This is Daryl Pullis inviting you to listen to America's Homegrown Veggie Show right here every Saturday morning at 10 Eastern Time. Great guests, great tips, and valuable information about growing your own vegetables, fruits, and herbs.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Whether cruising the strip in a 57 Chevy or taking the family on a vacation in a 71 Oldsmobile Vista Cruiser, you need to tune in to Classic Cars with Steve Ronaldo and Jim Weber every Saturday from 8 to 9 a.m. on americaswebradio.com.
Perhaps you are struggling to cope with the disease of addiction. If not, you probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the trained staff at the Atlanta Healing Center address and treat every day. Their doctors and counselors with over 40 years of practice in the field of addiction can treat the suffering individual in a thoughtful, compassionate, and experienced manner and guide him or her along the path to recovery. So call 770-696-9862 and speak to a knowledgeable staff member about how you or your loved one can be helped to enjoy a better and healthier life. More information is also available on the website at www.atlantahealingcenter.com.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Well, welcome back to our final segment today on the Safe Senior Hour. And remember, elder abuse does not report itself. And again, abuse is physical, financial, and institutional. And we're very honored today to have a representative of the National Aging in Place Council, Doug Lueder, who is an owner of Prosper Healthcare, but he's an advocacy chair for both the Georgia Gerontology Society and the Atlanta chapter of the National Aging in Place Council. And Doug, we're glad you're here, and you're really giving us some very important information and enlightening everyone on the issues with home health care. Again, thank you for being on today.
Well, I sure appreciate it. Thank you, Joe, and we appreciate you continuing to get these messages out there to your listening audience.
Again, education is the way to help prevent, not prevent abuse, but to report abuse, which will then help prevent it. In our last segment right now, what I do want to go over is have you give us some ideas. I'm out there in my home. I've got an aunt or my mother, and I've got to decide who or how I should have somebody come at home and help take care of her. And of course, I'm going to pay. And we already talked about there are some government programs that help pay for it if you're in the VA, and I think you said, was it Medicaid and some other ones, and of course private, if you have long-term care insurance, some of those pay for it. But what are some of your recommendations or things or that we should look, that as citizens we should look at in trying to select a company to have somebody come into our house?
Certainly, yes. If the decision has been made to go through an agency versus hiring an individual privately, then utilize the power of the internet, because reviews are so valuable, and you can go online and you can find out if a company does have good reviews. Let's face it, there's reviews for just about every type of business out there today. So when you're considering bringing in a caregiver into your home, I would most definitely check out their reviews. You can also confirm that they're licensed and bonded and insured. Those are all the things that offer the protection that I feel is so important, and what you get through an agency versus if you just hired a private individual.
Well, okay, so I look out there and I see XYZ company is a home health care provider. what happens then? I mean, just walk us through. There's a call, or how does that take place, and what are the things as consumers we should make sure that this company that we call, they answer these questions, or when they come to our house, that they do these things before we select them. Mm-hmm.
Sure. When I get a call here at Prosper Home Care, and of course a lot of people are finding us online at prosperhomecare.com, they're going to the good questions to ask again is making sure that you know exactly where this company is licensed and regulated by. In Georgia, they should have a license through the Georgia Department of Community Health. And I always ask or advise people to ask about insurance, because someone could say, oh, we have insurance. They may only have workers' comp.
Right.
We actually carry commercial liability, personal liability, sexual abuse coverage, criminal bond coverage. You know, we carry the whole gamut because we want the individuals to be protected. We want the caregiver to be protected. We want to be protected and be able to focus on delivering the care. So definitely find out exactly what kind of insurance policies they have. Professional liability is especially important because if a caregiver accidentally does something that results in harm and large medical bills, that's the policy that's really going to kick in. That professional liability will cover those costs, which in many cases can get quite large. We're also a Georgia certified drug-free workplace, so that's another very good question to ask any agency that you're calling. Are your employees drug tested? Do you have a drug testing program? Do you do local criminal background checks in addition to a national criminal background check? Very important, because a lot of the national criminal background checks are just a database search, and it does not get updated as often as it should. So getting those local criminal county checks is a very important thing to ask as well.
Well, okay, so let's say, I've called 3 or 4 companies, and now they're going to come out to the house. What happens?
Next.
What happens next?
Sure. You know, a lot of times we will send the nurse out first to do the assessment that was mentioned in the last segment, where an RN comes out and does a full assessment of the individual who's going to be receiving the care, making sure we know all their medical diagnoses, we know all their medications, we know their challenges, we know the things that they need help with, so we can best, keep them safe and healthy and improve their quality of life.
Okay, let me stop there. Is there an upfront cost for that, Doug?
There is not. Some companies may charge for that nurse assessment, but Prosper Home Care does not.
Wow, that's significant. Okay, I'm sorry. So you have the nurse that comes out.
And find out all the details. But what I often tell people is after I do all the things I do for pre-employment checks and training and nurse visits and certifications and all the things that need to be in place, after that's in place, I'm a matchmaker. It's time to put on my matchmaker hat and try to find the caregiver that best suits that family, because if that's not a good match, the home care we're providing is likely not going to work as well as it should. So we will send out caregivers to interview with the clients.
Wow.
and make sure it's a good fit. And there's no charge for those interviews as well.
Wow. So they come back, and then you have the report from the nurse. You have the caregiver, I won't say audition, that's not the proper word, but the interviews. What happens next? I mean...
Now, it's time for scheduling. We ask every family this question, and sometimes it's not 100% clear, is what is your best gut guess as to what days and what hours you need? Right. Most companies have a minimum number of hours. We have a 4-hour minimum. We do try to fulfill shifts shorter than that, but
4 hour a day minimum, or 4 hour a week, 4 hour a day?
At least a 4-hour shift.
Okay.
1 4-hour shift, a continuous shift.
Okay.
In special cases, we try to fill shorter shifts. We do have to charge a bit more money to pay the caregivers more money, because as you can imagine, especially today with the number of caregivers that are needed, it's hard to fill the shorter shifts. But once a client says, hey, I think 3 times a week, and mom and dad need a little help with breakfast and getting up and making sure they have lunch. So, how about 8 a.m. to 12 or 10 a.m. to 2? And once they've told us what schedule they think is going to work best, we start sending the caregiver. But if we learn that, hey, it really needs to be a little bit later because they don't tend to get up at that time, then we adjust it. So we will tweak the days, we'll tweak the hours, and in some cases we need to tweak the caregiver. If we hear some feedback and provide some constructional criticism and additional training to the caregiver to try to get that caregiver and client relationship where it needs to be, and it works, great. But if it doesn't seem to work, then we're gonna find other caregivers to send until we find that match that we're looking for.
Right. This is not. To me, this sounds like you're clearly that you've come in and this is a team, and the family and you all are part of the team to help care for the loved ones.
You're absolutely right.
I mean, you're not coming in dictating to them what to do. They're advising you what they think will work best for their loved one who needs the care, and that's what you'll try to work out. And I think that's what I gather. What you just said is a very, very important aspect of it. It's not like somebody just walking in and taking over, because all this has taken place before any contract signed or anything, right?
Correct. When the nurse assessment takes place, that is when paperwork gets signed.
Okay.
But there's no long-term contractual agreement. So although there's quite a stack of paperwork that's required by the Georgia Department of Community Health, none of it locks a client in to use us any longer than they need to.
What is the minimum? What is the minimum time period of your in your industry? Not necessarily yours, that you find that somebody comes into a home, they select your company. What's the minimum? Is it a 6 month, 6 week, 30-day? How long is the contract?
There are no term lengths.
Wow.
You could cancel after your first shift. Of course, that's not going to make any money for a home care provider if that happens. So we strive to make sure we're doing a good job, and we hope for long-term relationships if that's the best thing for the individual and the family and the loved ones involved. But there's nothing in any of our paperwork, and for most agencies, they don't have term lengths. So that's a very flexible part of this home care industry.
Well, I think so. So now that they're there, now they're coming, 3 times a week. What kind of quality review do you all do, or does the industry should do on the service you're providing?
Certainly. The Georgia Department of Community Health, again, has regulations that require supervisory visits. And for the higher need individuals, there's a required nurse supervision visit to happen at least every 60 days. For clients that are less in need of care, ones that are healthier, have less challenges, the supervisory visit may not need to happen except for every 90 or 120 days. However, one thing that we found at Prosper through my years of providing both privately paid for services and Medicaid, Medicaid requires visits every 60 days no matter what, and we've kind of adopted that standard. So for all of our clients, we go out a minimum of every 60 days. And if there's a hospitalization, we send a nurse back out. If there's a fall or a change in diagnosis, anything significant can also trigger a supervisory visit. We really need to stay on top.
Yes, I do. I appreciate you. It certainly enlightened me, and I hope it enlightened our listeners throughout the United States and the world about the advantages of aging in place that you, as a representative of the council, and what your company does. And I can't thank you enough what you do. So with that, I've got to remind everybody, we want to thank you, Doug, for being here, and remind everybody elder abuse does not report itself. And with that, that'll be the end of today's session of the Safe Senior Hour with Joe Gavalis.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Perhaps you are struggling to cope with the disease of addiction. If not, You probably know a family member or friend that needs help in battling the cravings and the personal and professional damage done by the effects of drugs or alcohol. Get a pen and paper and be ready to write down the following. These are the issues that the